Hi, my name is Griffin. I'm the Veteran Service Officer. I'm going to talk about aid and attendance today, because I think that's why most of you are here, for aid and attendance. But we're going to build up to that. We're going to talk about what VA calls their improved pension disability programs. There's three parts of this. There's a basic pension, there's a homebound pension, or housebound pension, and there's an aid and attendance pension. I know that's why you're all here, but I am going to go through the basic pension and the homebound pension first, because it builds on a foundation of aid and attendance. So once you understand those two, which are much simpler, you'll understand the more complicated aid and attendance. There are other VA programs that do exist, but I'm not going to talk about them today, okay? I'm just going to talk about these three things. You're going to have some questions. I'm going to ask you to restrict your questions to what's up on the current slide, because I may be answering your question in the next slide. So please be patient. And ask me questions that will be general to the whole audience, not specific questions for you. We can do that after the program is over. And the presentation is intended to be very general. Very general. Okay, I wanted to introduce who I am. I'm the Veteran Service Officer in Medfield. I'm an employee of the town of Medfield. Okay. I do not work for the VA. So I don't have any special connections, no red phone, no hot phone, no connection. They really don't know about me. I assist in explaining and understanding and applying for veterans benefits. I don't make the decisions. I don't judge anybody, and I don't authorize any benefits. So I'm just to help. I'm not a financial advisor, I'm not an attorney, and I'm not an estate planner. Okay? Just help understand and explain the veterans' benefits. So, the general qualifications are that the veteran has any other kind of discharge other than dishonorable. If you have a dishonorable discharge, there's almost no veterans benefits that will be available for you. You have to have served during a time of war. Depending on the war, it may be 90 days or 180 days, but you have to have served in a time of war. If you served only during a time of peacetime, then these benefits are not available to you. And it's really kind of hard to serve in only peacetime. Our country doesn't have many continuous years of service without peace. The one area that comes in is between the Korean War and the Vietnam War. There's about 7 or 8 years. So I do run into veterans that serve only in peacetime. The spouse has to be married to the veteran or married to the veteran at the time the veteran passed away. Okay, if you're divorced, you lose the benefits along with it. Now, this is benefits that are available to both the spouse and the veteran, which is why it's very, very important to everybody. Very few things are open to the spouses as well. So you have to have a permanent and total disability to get any of these pensions. Permanent and total disability. There is income and assets are considered. Okay, and while there's no number of income or asset that you can say over and above, it is always considered in their what they will help pay for. Okay, it is a factor. On the other thing, you do not have to be a service-connected disability. You know, if you don't have to have any service-connected injury. In fact, it works out that it's better you don't, because you can't take both. You can only take one or the other. You do not have to be retired from the military. Okay, in most cases, it's 180 days of service. You do not have to actually have been in combat. Okay, do not have to have been in combat. And it does not involve VA healthcare. Okay, VA healthcare is a separate presentation, a separate benefit completely. This in no way mixes with the VA healthcare system. So we're not talking about the VA healthcare system. The application. You're all going to see a lot of ads in the newspapers about financial planners and attorneys who say, come to me, I'm going to talk to you about aid and attendance, we're going to do some estate planning. Be wary of these folks. Because when you do estate planning, you're going to disclose all of your financial assets. You're financially naked at the end of this application. And what a lot of these folks do is they get you in the door, and then they find out about your assets and your income, and then they engage in selling you other products, like reverse mortgages, like annuities, okay? And these are products you may or may not be interested in, but they're just getting you in the door. So you have to be very careful of these folks, and they're out there all the time. I see the ads all the time in the paper. In part of this, they'll say, we won't charge a fee for doing the aid and attendance application for you. And they won't charge you a fee because it would be illegal if they did. It's illegal for anybody to charge a fee to fill out that application. Now, they can charge a fee for the preparation, for the research, for the planning, and to help you prosecute a claim if you had a claim that was denied and you wanted to appeal it. But they cannot charge you a fee for the application. And only accredited agents or attorneys may apply for the VA. The VA offers a course that they have to pass. And that course teaches them about aid and attendance, teaches them about the application. If they didn't go to this course, they shouldn't be offering this service to you because the VA hasn't accredited them, okay? They may have went to college, but they didn't go to the VA college, and that's necessary. All right, these are allowed for strategic planning, estate planning, long-term planning. They can charge for that, and they're allowed for preparation. When you get to the aid and attendance application, there's a lot of components to it, and you have to find your birth certificate. You may have to find death certificates, marriage license, things like that. Sometimes you have to work hard to dig up that information, and if that attorney is digging up that information for you, he's allowed to charge you for the work that he does. So, the application. The application is to get a timely application, and I'm talking about timely application would mean about a year long. So in all cases, the application process is very timely. So a bad situation would be more than a year. In the best way to cut down the application time is you have what we call a complete application. You make sure you answer all the questions. You make sure you supply all the supporting documentation. So when all this information goes to the VA and goes through the review process, they don't ask for anything. Because if they send you a letter, and it will be a letter, and they say, you know what, we need your death certificate. You just wasted 3 months. Because by the time they send you the death certificate, you go get a copy of the death certificate, they mail it back, you mail it back to them, and then it finds your file there, because if you've all seen the TV, you've seen that the file rooms are all stacked with file folders. And when it finally gets into your file, and then your file goes back to the beginning of the application process. Okay, you have to understand how the VA works. Your application goes through stations. And if you ever get knocked out of the station, and ask for additional work, you come back, you start on station 1 again and work through. And so that's why it's 3 months before you get back to where you were. So it's very, very important that you complete all the questions, and it's all in the application. There are multiple forms that you're going to need. You're going to need your Social Security award letter, you're going to need a marriage certificate, death certificate, all of your net worth information, and all the proof for your net worth information. Proof of all incomes and pensions, all insurance premiums, all bills, all medical bills. You're going to need physician's statements. You're going to need statements from the nursing home or statements from the assisted living facility.
What is the Social Security award letter?
When every year you get an award letter
Oh, okay.
that tells you what your income is. So you're going to need all of this stuff to compile it. So it's quite a thick application by the time we're done. So now I want to say to you, when it comes to the application, you'll need assistance, so go get it. And you're going to have to go to the people. Where you can get it is you can come to me. I can help. You can go to any VSO in Massachusetts. Every town has a veteran service officer. There are also many veteran service organizations that do this, the American Legion, the DAV, the Veterans of VFW, and the state VA offices. So there are other places that you can get free help. And you can get the help from an individual who has been accredited by the VA. And that could be an attorney, could be a financial planner. Okay, so now I'm stepping back. And I'm saying be wary of these folks. But I'm also saying when it comes time to go forward, you may consider them as being a very valuable resource. Because they're going to look at the whole picture. Let's talk about the basic pension. The basic pension, all these pensions are all tax-free pensions. All right, so if you get any money, it's tax-free. If you're under age 65, you have to prove that you are completely and totally disabled. So you're going to need a lot of medical proof to do that. If you're over 65, the VA says, okay, you're already disabled. You don't have to prove anything. So this kind of pension for someone that's under 65 is a little difficult to get. But once you're over 65, just turning 65 made you, in the VA's eyes, fully disabled. So that disability test is very easy once you're over 65. And what this does is basic pension is establish basic income levels. All right, similar to what SSI does for Social Security. Make sure that everybody has a certain income level. What's different about the VA is that income level they're going to look at is going to be after your medical expenses. So you get to deduct your medical expenses. So the higher your medical expenses are, really the lower your spendable income is. So if we and the medical the benefits, so there's three categories of people that we're going to be talking about. First is the single veterans, right? A veteran who's single. And they're saying that a veteran that's single, they allow that you should be able to afford $52 a month in medical bills. Now everybody's paying more than that because the Social Security Part B plan is $104.90. But they're saying, you know, over 5% of your income. Veterans who are married, they're saying $68 a month is a reasonable price to pay for health care benefits. And for a surviving spouse, it's $35. Okay, so these are the three groups of people that we're going to be looking at all through this. And there's actually a fourth group that I'm not mentioning here, and that would be if a veteran married a veteran. There's a special category for that. But so you're either going to be single, you're either going to be a veteran with a dependent, all right, and I say married, but it's really a veteran with a dependent. The wife is the dependent, if the veteran's the male. And the surviving spouse means that the veteran has passed away. So for a married veteran, the VA says $1,360 a month. That's what they want you to have as minimum income to live on. For a single veteran with is $1,038, and for a surviving spouse is $695. All right, so they don't treat everybody equally. And just Social Security supplemental income (SSI) is $710. So in this case, the VA is actually a little lower than SSI is. All income from all sources are counted. So that means your Social Security income, dividends, whatever kind of income you might have. Now, if you're on SSI, they don't count SSI income. So right away you're thinking, I can get a pension from the VA and I can get SSI. Not so, because SSI counts a pension from the VA as income. So what will happen is your SSI will be lost because you'll be over income for SSI. So let's take a simple example. You've got a single veteran. His income is $1,278 a month. He's got a Part B premium. I rounded it off from $104.90 to $105. He's paying for AARP Supplement 1 MedX plan for $211. So he's got $316 in expenses. Then the VA says, okay, but 52 of it, we expect you to pay. So that leaves him with $264 a month in really deductible expenses. So he can take his total income of $1,278, and if we subtract the $264 he has in expenses, he has an actual income of $1,014, a little below the $1,038 that the VA said he needed to live on. So he would get a check for $24 a month. Okay, very easy example. Obviously I didn't take into a lot of account. I didn't take in a Part D plan. I just wanted to make a simple example for you. All right, that you can see that even though his income was over the amount, he ended up getting only $24. Right, he didn't get the full $1,038. He only got $24. Because each time I bring up, that's the maximum possible benefit you can get, where the minimum possible benefit would be $1. But these are the maximum benefits that they would allow. So let's talk about a housebound. So again, if you're age 65, you're already disabled, so we've already crossed that hurdle. And but to be housebound, you have to provide some proof that you can't leave your home without systems. Okay, so some of those issues, maybe that you're bedridden, we can all see, that being the case, or you're always in a wheelchair, that you have some walking issues, or you have some vision issues. But it really may all boil down to you can't drive. The doctors say, you need to give up your license. Well, now you're homebound. Okay, so you meet this qualification. The VA believes there's going to be more expenses with homebound, so they're going to, actually it's the same kind of basic pension, except they're going to elevate the amounts. Again, we're going to have 3 categories for single veterans, veterans who are married, and surviving spouse. And you can see the amounts are much higher. So for a single veteran, it's $1,259. A married veteran with a spouse is $1,570, and the surviving spouse is still low at $851. And let's look at an example. This is a married veteran. Their total income is $2,000 a month. Well, they got 2 Part Bs as their expenses. They've got 2 Blue Cross Blue Shield Bronze plans. So that gets them up to $578 in expenses. But, the VA says $68 we expect you to pay, so we've got to take that off first. So you end up with $510 as your medical expenses. And again, I'm keeping this very simple. So your total income is $2,000 minus $510 for expenses, gives you a net of $1,490. Well, that's below the $1,570, so you're going to get a check every month for $80. Not a lot of money, but you can see that the amount of medical expenses is really going to determine the amount that you get. Benefits are not a fixed amount. All right, in the 2 examples that we went over so far, the maximum benefit was not achieved. There are no income restrictions, And the medical expenses really determine the reimbursement. The higher the medical expenses, the more likely you are to qualify for one of these pensions. And the only way to receive the maximum amount is to have medical expenses that exceed your income. You're living on your assets. If you're in that situation, you could get the maximum amount. Expenses that exceed your income don't result in a greater premium or greater benefit. Once you reach the maximum, it's the maximum. It doesn't get to be any more than that. Let's talk about the medical expenses and what might be covered or what might not be covered. Because it's the same in all cases. Nothing is covered in everything. So it's not like you go to VA and say, do you cover this? Any more than you go to the IRS and say, do you cover this medical expense in my tax deduction? There are certain expenses that are allowable. Whether you make the choice whether or not you're making the expense. Okay, the VA is not granting you, saying you can have an attendant come into your house. They're not determining that. You're determining that, probably with your doctors. Okay, so you don't have to go to them for permission. These are just the expenses that you decided to incur. The obvious ones, of course, are your Medicare Part B premium, your Medicare Part D premium, Medicare Supplement premium, all co-pays and all deductibles. So, all those pharmacy receipts that you go when you get your drugs, all those co-pays are countable. If you pay anything at the doctor's as a co-pay, that's all countable. Whether or not it's covered by insurance, okay, those are all countable. All unreimbursed medical expenses. Now the cost of a long-term care institution, okay, now that's pretty expensive. Cost of assisted living, adult daycare, diabetic surprise, private caregivers, incontinence supplies, a reality, and they get expensive. So all of these kind of things roll up into your medical expenses. And you can see with this now it's getting a little complicated because we really have to keep a lot of records about your medical expenses to get the highest amount of benefit from the VA. And this sets it all up for aid and attendance because it's really going to be the same thing. You have to have a disability. You got that when you turned age 65. You have to be unable to perform certain activities of daily living. All right, and the activities of daily living, you know those are being able to toilet, being able to transfer, being able to eat, being to dress yourself, to bathe yourself. Those are the activities of daily living. So higher medical, or there's a mental cognizant problem where you have Alzheimer's or something and you can't be left alone. So that would qualify. And again, it's the same 3 benefit level people. So with aid and attendance is the physician has to state that you can't do these things. Okay, so it has to be you can't say I can't do them. The physician has to say she can't, he or she can't do them. Blind people would automatically qualify. Alzheimer's, you'd have to get a letter from the doctor. But again, this is all assist with eating, bathing, dressing, undressing, taking care of needs of nature, and needs to live in a protective environment. And these are the amounts. So for a single veteran, it's $1,732. For a married veteran, $2,053 is the maximum benefit, and for a single surviving spouse, it's $1,112. Let's take the example. This again, a married veteran. Their total income is $5,000 a month. Okay, that's pretty decent income. But, and we'll take the usual Medicare Part B, Blue Cross Blue Shield, the bronze plans, and now you add on one of them is in assisted living. Assisted living, let's just say they're paying $150 a day. Maybe I'm being naive here, that can't get assisted living for $150 a day. But mathematically, that turns out to be $4,500 a month. So they have $5,010 a month in medical expenses, just very easily. And you subtract that from their $5,000 a month income, and they have a net income of minus $10. So they would get a check in the amount of $2,053 from the VA every month. All right, you see how it works? It's all about deductions and how to work towards that goal benefit. All right, the assisted living situation is well suited for VA aid and attendance. Okay, because MassHealth often is not involved yet, because you're not sick enough to be nursing home eligible. And the cost of assisted living is high. So just about anybody who is in assisted living, it eats up all their income. And what the VA is trying to do here is, while one person is in the nursing home, but the other one has enough money to exist. There's also a limited need to document expenses. You can see where I've set a scenario here where you've got to do an extraordinary record keeping to get any of the benefits. But if you're in assisted living, they're really doing all the paperwork for you, and they just provide you with one statement, and it takes the burden of all that documentation off. So that's where it's most suited for. We didn't talk about assets, and do they count? The answer is yes. What the VA does is it really has some discretion here, and where this discretion is always the presumption of inequality. But what they're going to do is they're going to look at your illness, they're going to look at all your assets, they're going to look at your life expectancy, and they're going to come up with what's acceptable and what isn't on a case-by-case basis. So I can say to you that if you're a married veteran and you have more than $80,000 in assets and savings, I'm saying there's a good chance you're going to get denied.
I'm sorry, good chance.
You're going to get denied if it's over $80,000. And if you're a single person, either a widow or a single veteran, if it's over $50,000, there's a good chance it's going to be denied. So I just want to throw those out as just round numbers, because I don't know what's going to be accepted or what's going to be denied. But based on past experience, we know that these numbers seem to be fit in the go, no-go chart. For aid and attendance, when you look at it, you look at the big picture, because now we're looking at assets, we're wondering about how to stretch those assets. And I said what I would do is, sometimes the claimant represents himself. I don't think that's a good idea. I said sometimes I would help with the application, but I don't do financial planning or estate planning. So, and all those veteran organizations that I discussed, they don't do that financial planning either. So you have to look, I think you have to look at the whole picture. So I think that now those financial planners and estate planners are looking even better if you have a lot of assets. Because they'll know how to make those assets disappear. And they also have knowledge about MassHealth. And why this is important is because you can do things under the VA, and it might be a smart move to get a VA benefit, but it might be a dumb decision for MassHealth, and you may deny yourself a MassHealth benefit later on. So you want to be sure you make a smart move that doesn't affect future benefits that may come from MassHealth. If you get a check for aid and attendance or any of the pensions, must you spend it on medical expenses? Do anything you want with it. Okay, you can spend it on beer, you can spend it on medicine, you cannot spend it at all. You can save it if you want to. You don't have to do anything with it. And that now opens up another possibility of a strategy of how to use this benefit to save some of your money. The VA has no look-back period on assets. So, before you fill out the form, if you want to move your monies around, no problem. You can give it to whoever you want to give it to and make it go away if that's what you want to do, if you think you're over asset. And this is where the attorneys will guide you how to do that. You know, maybe it's buy a car, maybe it's setting up a college fund for a child, a grandchild, whatever you want it to be. You know, but you all know that MassHealth is a 5-year look-back period. So you wouldn't want to do too much if you think you're going to need MassHealth within 5 years, because you wouldn't want to upset that apple cart. But the VA doesn't care about your assets. You can move them all around today and then do your application tomorrow, and they'll be fine with that. The VA also allows you to pay a son or a daughter or a granddaughter as a caregiver. Okay, this is something that other agencies don't allow. Now, it's within limits. You know, that you have to be reasonable. You just can't say I'm going to give them $1,000 an hour. You know, it has to be reasonable with the amount of what cost that there is, and you can pay that person the money, so that becomes a medical deduction. So say, you know, you are at home and your daughter comes and helps you shower every evening. You know, you can say, oh, that's worth some money. You know, I can give you the money, and it'll count toward my medical expenses. So you can't do it with the spouse, though. Okay? Unless that spouse is working, that would be a different story, because now you could say that that spouse gave up their job to take care of you. That would be something that they would accept, but not normal. You have to. And someone that is not part of the family, you know, even though it is a close member, a daughter perhaps, or a son, you know, you can pay those. And other agencies won't let you pay close relatives for caregivers. They'll pay strangers, they'll count that as deductible, but not family. Aid and attendance payments are not countable by MassHealth. So all those monies, if you got any monies, whether it's the $4 a month, or $24 a month from the first example, all those monies, MassHealth can't count them. Okay, they're tax-free and they're not uncountable. So as long as you keep that money from your other monies, you know, don't mix them up, you know, it will be non-countable. Right? MassHealth can't count any of the payments to the VA pensions. So those are not a problem. They won't make you ineligible for MassHealth or over income for MassHealth because they can't count them. For the nursing home, though, the VA pension plan often doesn't work very well. And that's because the cost of the nursing home is astronomically high. Right? It's much, much higher, so it uses up all their income. You know, it's just too much. And then if you do get MassHealth, eventually when you're in a nursing home, then whatever you were getting from the VA pension drops down to $90.
It counts what?
Drops down to $90.
Okay.
So once MassHealth pays the bills, you know, your number drops down to $90. Now you can keep that $90 because MassHealth can't count it. MassHealth lets you keep $72 a month. That's what they allow you to keep. So you can be very rich in the nursing home because you have 72 plus 90, where everybody else around you has only 72. So you can buy the pizza and beer one night. Where it does come into play is sometimes MassHealth establishes a spend-down. And they say, okay, you've got a lot of assets. So you have to spend down those assets before you're eligible for MassHealth. The asset limit in MassHealth is $2,000. So you have to get down to $2,000 in assets before MassHealth will kick in. So let's look at an example of how that might work. Let's just say you had assets of $80,000. MassHealth is going to say, okay, you got to spend $78,000 of it before we're going to help you out. The nursing home is going to cost $7,000 a month. And your income is $4,000 a month. So you're in the whole $3,000 every month. So you would get the entire aid and attendance payment of $1,731, and you can and it would take about 2 years, 26 months, for you to spend down that $78,000 that MassHealth said you had to spend down. So you spend that down, you get the $1,731 every month, You set that aside in a bank account. Don't touch it, don't mix it up with your regular money. At the end of 2 years, you're eligible for MassHealth, but you successfully put $45,000 into a savings account that MassHealth can't touch. So even though you had $80,000, you ended up salvaging almost half of it. So, and this is where an attorney or a estate planner can come in very handy, because they can work these for you. You know, I can't do that. I'm just telling you an example, but I can't guide you through that. I can guide you through the application process, but not through the financial planning process. That's a strategy that those financial planners are looking for when you come in to the office to talk to them. And you can plan for that. When MassHealth takes over, then you go down to $90 a month, which is what you get from the VA. Okay, veterans who are collecting a service-connected disability, you know, you can't connect both. You can do one or the other, but you can't collect both. All the claims are processed in Philadelphia from the entire East Coast. So you can imagine what the office looks like in Philadelphia. You know, boxes everywhere. And obviously they don't have enough staff because it's taken so long to process the applications. I hear they're working on increasing their staff. And I hear they're working on becoming, have the application process be automated. It's a paper society in the VA still. So it's paper, paper, paper. And they're not using the computers to automate the application process. So that's why it's a year-long claim. And that's why we spend so much time talking about what we call a fully developed claim, getting everything together. So you send everything that's needed in with the application, and you'll get the best turnaround time on getting applied and denied. Because if you have to wait a year for this help, a lot of folks don't have the monies to last them the year before they can get the assistance. So it's better to take a little extra time on the application, and you'll get rewarded because it'll get approved faster. And professionals generally, you know, lawyers especially, they're used to always doing these fully developed claims. You know, that's what they do in their world. And that's why it appears that they always do better at getting claims approved through the VA. And it's not really that their claims are any better, it's their methodology of putting information together and making sure that they provide all the answers is what's giving them the rewards. And it appears like they're getting preferential treatment. They're not. They're just putting everything together in a nice, neat package, giving it to the VA, and it just slides through the process. Now, I've done everything as a monthly thing. In reality, everything's calculated on a year. So you're going to take, just like your income tax returns, you're going to take all those medical expenses for the past year or for the upcoming year. You're going to calculate them all up because everything's done on a yearly basis. But it's easier for us to work in monthly examples. So I use those. There are other, I do want to mention that there are other facilities, veteran facilities in Massachusetts. There's a soldiers' home. There's 2 soldiers' homes that are state-run. There's one in Chelsea. They only have 88 beds, so your chances of getting one is not very good. And it's only for veterans, not the spouses. Holyoke has 285 beds, so they have many more beds. But you're out in Western Massachusetts now, or you're in Chelsea. You're not near Medfield at all. So a lot of people don't use this choice because it's not near their family. And being near your family, if you're in a nursing home, I think that's very important to have visitors. There's also a VA hospital at the Bedford. And that's 100-bed, and that's an Alzheimer's unit, only Alzheimer's people. Again, only veterans. So those are other facilities that are in the state that you may go to. And I think the Soldiers Home is $30 a day. So I mean, it's a bargain if you can get in there, $30 a day. Okay, and now we get to the questions. So I appreciate that there hasn't been many questions, but I hope There's two reasons for that. One, because I've explained things well, or two, because I didn't explain things well, you don't even have enough to ask a question. Any questions?
The slides that you just showed, is this something that you made up yourself?
Oh, yes.
Or could so I couldn't go on the internet and download it?
This is the official, man,
Sure.
this is the official thing from the VA. And this is what I try to do, is turn it around and explain all of what they're trying to say. They've done it very nicely in 3 pages, I think. But they missed a lot of detail. And I think this is why I try to expound on it. But no, this is the first time I've used this slide presentation, so I was up last night finishing it off.
I see they do have some links there on the back
Yes.
page though.
And of course, you all know that I'm at Town Hall Monday and Thursday afternoon from 1 to 4. Stop by and see me. If you can't get up there, call me. We'll work out a deal where we can meet someplace. I'll come to your house. It's not, we can do that. Because a lot of this stuff takes a long time. But if it's just information, please stop by the office. I'll answer any questions. That's all I can do. I don't. Again, I tell people, apply. It's only your time, my time, and a stamp. Let somebody else decide if you're eligible or not.
The total income that's a big bearing on the case. It's in the case.
The total expenses has a bigger bearing, I think. Because you can't be over income, but if you have enough medical bills, you can really write off all the income. So it is a factor, certainly. Yes, ma'am.
When I had contact with a relative that was going into assisted living, an elder attorney told me that assisted living programs had benefits for veterans, war veterans, that wasn't widely publicized. Did she really mean this pension?
She's exactly, this is the presentation she's referring to.
Okay.
Very few people know about this. It's often misunderstood. A lot of people think that it's a fat sum of $2,305 or whatever the number was, and it's not a flat sum. It can be up to that. And very few people do apply for this. Very few people do apply for this. So that's why I'm talking about it today.
Ron, when you talk about assets, that's cars,
No cars, no first house.
No.
Yeah.
and then it's bank accounts.
It's bank accounts and second house, if you have one. But no, the first house that you have and the car that you have, one car, it's not considered an asset.
Retirement accounts, I'm assuming, would be.
Retirement accounts aren't counted.
Investments account.
Investments are counted. Reverse mortgages, the income from that is not counted. That's unusual. So some people have a reverse mortgage where they take money out every month, and that money won't be counted as income. So some of them are strange. That one, because it's really a loan. You're just getting more. You're just borrowing more. It's what you're doing. Yes.
The example you gave for a person with $80,000,
Yes.
I wasn't able to follow the rationale of how half of that in 2 years' time can go over to a bank account and not and avoid the spend down limitations.
All right. I'm trying to pull up the slide again. Where the number came from is that you were getting $1,731 from aid and attendance every month. And so you would get that check every month, and if you banked it, okay, because you don't have to spend it, if you saved it, after 26 months, you would have $45,000 in there.
And AA, what does AA stand for again?
Agent attendant.
Aid and attendance.
Oh, aid and attendance. Okay, all right.
So that's the VA pension payment that they're
That's the
giving you.
VA, but that's the VA income that you're getting.
Right.
Okay.
So your 80,000 asset, you know, from MassHealth, looks like it disappeared because you spent it. You paid it all to your to the nursing home.
Yes.
But at the end of all of this, you have $45,000 in the savings account
Okay.
that the MassHealth can't touch.
I'm with you now. Thank you.
Thank you very much.
Thank you.
I hope you enjoyed it.
Thank you.
Production support provided by Medfield.tv. Access to our community.